The Kids Count report is out. It's an annual update from the nonpartisan group Advocates for Children of New Jersey that looks at how kids are doing across all 21 counties. They measure it across a range of demographics, looking at economic security, health, education, and many other measures. There is some good news. Some areas are showing improvements, but others are not. The report highlights some serious concerns, what the authors call a shadow pandemic. Mary Coogan is president and CEO of Advocates for Children of New Jersey, called ACNJ. She joins us now to discuss the findings. Mary, so good to have you with us. Let's start with the good news. What are some of the things that are going right here in New Jersey?
So what's going right? So median income is up for most families. You see unemployment has just gone up a little bit, but economically people seem to be pretty steady. Even though we have concerned about the number of people enrolled in New Jersey FamilyCare, which is our public health insurance system, it's just back to what it was pre-pandemic. So although there's been 100,000 children disenrolled or have left FamilyCare over the past 2 years, some of that could be because people are back to work and they're now on their parents' insurance, right? Or some of them, because they're back to work, they no longer meet the income eligibility. But I think we're more concerned about the drop-off because in certain counties, the uninsured rate is starting to creep up.
Yeah, so across the state, the uninsured rate is about 4%, which is held steady, right? But let's point out, Union is 8%, Essex is 6%, Hudson and Mercer are both 5%. So do you have an indication as to the why there?
This is just anecdotal at this point, but those are also counties where you have higher immigrant populations, and there is some concern that because of what's going on from the federal government, that people who might have an undocumented person living in their household, even while the child might be eligible for family care, they are withdrawing from public programs. But even for New Jersey, for family care, a child, even if they're undocumented, they can still enroll in family care. It's covered by state dollars as long as the family household meets the income eligibility requirements. So we shouldn't be seeing those kids drop out, but I think we're hearing that they are.
What is the impact? We talk a lot about the impact of being uninsured or underinsured on adults. We don't often talk about it for kids. What is the impact if they don't have that insurance?
People don't get the preventive care. And when they don't get the preventive care, or they don't go to the dentist for the regular checkup, and family care covers dental care, and a lot of people don't realize that. So kids might be in pain going to school, or they might be sick or have a cold, and a parent, because they don't have insurance, just waits a little bit longer. Or a child may suffer from asthma and they don't get their inhaler renewed, or they just kind of wait without the preventive. Yeah. And what happens is it becomes more expensive, but then the child could get sicker.
You looked at academics, and there are some positives, right? The state invested in early pre-K education, expanding that throughout the state. But then you also look at achievement scores, and help us understand what this shadow pandemic is that the report talks about.
So it's a couple things. The preschool, the number of kids enrolled in preschool is over 65,000 kids on an annual basis, which is wonderful. And Governor Murphy should be applauded for expanding preschool to as many counties as he could. I think what we're seeing as a result of that, though, is there were community child care providers who sometimes could partner with the preschool program in the school district, and that partnership is not being developed. And so the preschool expansion, which naturally, if I can send my child to a free preschool program, I'm going to do that, is starting to have a negative impact on the community provider. So we're hoping that more school districts and community providers will partner. That will also give parents more choice. So if my child's been in a certain child care center and I want my child to now stay in that community provider for preschool, I should be able to do that. So we want to see that. I think with the other thing, though, we're seeing with the school, like the older kids, we're seeing more chronic absenteeism. And chronic absenteeism is where a child misses 18 days of school, or 10% of school. So according to the data we did collect from the Department of Education this year, probably 6 in 10 schools have a chronic absenteeism problem. Kids are hesitant they're overly anxious, they're not wanting to go to school. It could be for a variety of things, which could be the result of the pandemic and sort of being isolated. It could be the result of bullying or kids having behavioral problems, but
chronic health issues as well.
Sure, absolutely. But if they're not in school, they're not going to learn. And while we're seeing the reading at grade level by 3rd grade or 8th grade, it's starting to creep up. It's not at all where it should be.
Is it true that still half of all 3rd graders are not proficient in math and language?
Yes.
English language arts?
Right. And if you're not reading by 3rd grade, you're always going to be behind.
Right, because at that point you learn to read and then you read to learn.
Exactly.
Right? Maternal health still a challenge. We know this is something that First Lady Tammy Murphy made a significant priority during her administration, but we're just still not there yet. What are the disparities as we see them laid out in the report?
So I agree with you. The Nurture NJ campaign brought the needed attention to the disparities. We are still seeing twice as many African American moms not getting the prenatal care that we want them to get. We are also seeing twice as many Black babies being born prematurely or at low birth weight than their white peers. And we're seeing, unfortunately, infant mortality is for Black infants, which is meaning dying before age of 1. It's, I want to say, over twice the state average. So all of that says the attention has been raised. We've seen an increase in doulas, which can help moms. I think it's gone from like 80 to almost 200 doulas now, who can help pregnant moms advocate for them, right? Or if they feel like they're not being listened to by their doctor or at the hospital. And all that's wonderful, but the disparities is really making us at ACNJ start to think we need to be in the community talking to moms and figuring out what's causing it, but maybe we need to be looking at overall health, because having a baby takes a toll on your health anyway, and maybe if women were healthier when they became pregnant, you wouldn't see so many problems.
And we know too often women care for others, take care of themselves last. It's a chronic problem that exists. But all good data, and certainly for you and your team, a whole lot more to kind of process in terms of understanding what to do about it, right?
We're trying. All
right, we got to leave it there. Mary Coogan, President and CEO of Advocates for Children of New Jersey. Thank you.
Thank you.